Thank you. Paula.
Thanks. Paula Griswold, I'm Executive Director at the Massachusetts Coalition for the Prevention of Medical Errors.
Hi,
so
Paula.
I'm not on a PFAC. Yes, hi, after all of those years of emails. We had actually early on, when there was a requirement for PFACs in Massachusetts, had Institute for Patient and Family-Centered Care do some really valuable training. By the way, one thing that always stuck with me from that training was someone at Spectrum Health, their patient co-chair, said she reached out to all of the clinicians and the staff in the hospital, like on a regular basis, and asked them if they saw a constructively discontented patient or family member to please refer that person to her. So that just stuck with me as a great way of recruiting. But Monique and Michael, I would love to know, do you ever think about, you talked about broadening the participation and the input to the PFAC. Have you ever felt there's a way to work on sort of deepening or encouraging people to ask for more? Like, is the PFAC ever cautious about what they feel that they could ask from the hospital? Is that ever something that you need to address?
Can you give an example, Paula, or elaborate on that? Just
well, if it's I don't have a great example from healthcare, but I was sort of thinking of, was it Henry Ford who said, if I'd asked my customers what they wanted, they would have thought it was a better buggy. They weren't thinking that with the possibilities of having a car. So if there's ever a need to encourage people to go ahead and be more demanding, more creative, I'm not sure what just not feel cautious about what they might be expecting from the hospital.
Yeah. Well, I think, and if you go back in history, right, folks would have been afraid to voluntarily have PFACs because of exactly this issue. They're like, well, if we have a PFAC and we ask patients and families what they want, boy, what are we going to do when they tell us, right? So, but I think things have evolved on both sides. So both PFACs understanding, for example, what the financial constraints are, what the staffing constraints are, what the realities of healthcare are today, and acknowledging that we, as leaders, we have to try to listen and be accommodating for the needs of our patients. So it feels more like a healthy dialogue than a demand and a response kind of thing, I guess, is the way I'd approach it.
Yeah, thanks. That makes sense.
Right. Monique, do you have anything to add?
Well, when she was talking, I was just like thinking, and so like for broadening the PFAC and getting people to know more about it and getting more leadership involved and more patients, families involved, especially patients and families. I don't know. I mean, I think that like when social workers go in and talk with families and families want to hear. I know when I was a patient, I wanted my voice heard, and I had to be my own best advocate. And I am so grateful that I belong to PFAC, but there aren't a lot of people that know about PFAC. And I'm thinking like maybe social workers that talk with families, they can like maybe mention like PFAC if, families think that they are, if social workers think that they're passionate and stuff about things, maybe brochures. I mean, I think we talked about this at one of our PFAC meetings before, little brochures, cards that are left on, that are in the rooms, like, when you go to a hotel room and stuff. I mean, it's tough being a patient, right? And you want your voice heard and stuff. And yeah, I could go down the rabbit hole, but I won't.
Well, thanks, Monique. Tara, thank you for your patience.
No worries. I just wanted to respond to both Charles and Michael's comments, and I think my background says where I'm coming from in terms of Newton Wellesley Hospital. And so I'm glad that Charles is on there because I'm co-chairing the PFAC 1 month into it, or one meeting into it. And I was just thinking there's some great ideas from this discussion that should go back to our PFAC. But I also wanted to echo what Michael was saying. I think it's really important for PFAC members to bring forward what they're really interested in terms of topics, so their hospital partners can make sure to bring that content forward. And then I do think from sort of just even in hospital industry and healthcare, we are trying to figure out that balance of the system influence and the local influence. And I know that's being considered at the MGB level in terms of what is the PFAC structure across MGB, because we don't want to lose the patient voice. So I thought both of your comments were really important, and were, I will take them back with me. So just wanted to offer my reflection on that.
Great. Thank you, Tara. I think we've just gotten the notice that we're going to be shifted back to the real world shortly. Jill, I'm very sorry we didn't get to your question, but my contact information will be at the end of the presentation. So feel free to reach out, and I can connect you. Or if you just had a comment you wanted to make, feel free to add it to the chat. So I apologize for that. But I think we're all going off into cyberspace.